This is a story of a man and his dream. Joe Kanter was born in the South, and by the time he was 30, had earned enough to retire. He founded a construction business that built apartments for rent to returning veterans. Joe Kanter did not retire. He got married and took a leave of absence. Now, in 2012, he is on the edge of realizing his dream through the Kanter Health Network. The foundation's goal is historic. It will be the first time that millions of patients' real-world experiences with healthcare will be brought together and shared. Because of the foundation, current and future generations of citizens will significantly benefit.
Outcomes research database utilizing electronic medical records to produce what works best in every disease does not exist in the United States and does not exist anywhere else in the world. And that is the Kanter Family Foundation's mission.
The mission had its beginnings when Joe was diagnosed with prostate cancer at age 65.
I received from one doctor a diagnosis, and he says, I'm a very good candidate for surgery. I said, well, why am I good? He says, well, you're healthy. I says, well, I want to stay healthy, and I'm not sure I want surgery. He said, well, that's the only thing that's going to help it. We do have radiation, but surgery is the gold standard. As a result of that, one of my long-term principles has been that there's no such thing as minor surgery.
Joe Kanter realized his was not an isolated case.
When I would ask a doctor, well, what are your experiences and why do you make this recommendation? And they usually begin by saying, in my experience. I said, but doctor, is there any evidence? Are there any randomized clinical trials? Or other than your experience, what are my options? And they had none.
According to studies, 50 to 80% of doctor treatment recommendations are based on anecdotal data, not evidence-based.
And that's not because they don't need extra information or they don't want it. It's because we haven't got it yet.
The Kanter Health Foundation wants to get that information and believes that the database of patient outcomes could total 50 million patients. Joe Kanter calls them heroes and has written a book about them. The Kanter Foundation knows it has challenges, but Joe Kanter is used to that.
A couple of the people that know me best in healthcare, please don't tell Joe Kanter it can't be done.
You like to hear that, don't you?
Yes. Because this is, we are about to get some things done.
There is a crisis. Joe Kanter is bringing together the best and the brightest to help accomplish the Foundation's goals and is calling on his health legacy partners to step up and contribute to building a voice for patients through the Kanter Health TV network.
We're holding a summit in Washington, D.C. in early May. And we are bringing to it the leadership of all of the individuals and corporations and organizations. But it's not going to be a conference where we talk and we have publicity and then we dissolve. We are going to attempt to get an association or a federation of organizations that are willing to state and sign a common purpose goal. Educating the public of what they have to know about their health care, and providing an outcomes research database of 50 million electronic medical records of individuals from birth to death that will provide the physicians and the patients with what works best in every disease.
Dr. Richard Tannen is a member of the Kanter Health Foundation Board. He is an expert in developing healthcare databases. He believes the Kanter Health Project could outshine the National Genome Project that mapped the 25,000 genes that make up human DNA and stored the information in databases.
It's as crucial, if not in some ways more crucial, than the Genome Project for really advancing healthcare, not only in this country, but in the world at large.
To communicate the advances of matching database outcome to patient treatment, the Kanter Health Foundation is setting up an internet television network on healthcare. It will include Kanter-produced original content, plus content from health partners.
Why not use the internet to save lives? And we hope it's going to be millions of lives, maybe even your own.
The Kanter Health Network is calling on the private sector, for-profit and nonprofit organizations, individuals, health legacy partners, and donors to help make the Kanter Foundation dream a reality. For more information on the Kanter Health Foundation, contact us today at kanterhealth.org.